Did you know that certain kind of vitamins can help your teeth and gums be healthier? Yes, it's true. So we want to talk about 4 important vitamins that you can get today that will help you improve your teeth and gum health. And they're pretty easy to get to, in my opinion. So I think that'll be a lot for you to learn today. So stick around and listen up. We can help you. All right. So we want to make sure that we look at all the whole atmosphere when you are in our chair as a dental hygienist. So we want to make sure that you're flossing and you're brushing like you need to. Sometimes we get past the point where that's not working. Whatever you're doing, everything you're doing, you're good, all you got, and it's still not healing. We want to make sure that we're looking at your diet always, because your diet can affect your health or cause it to be worse if you're not getting enough. So these are very important foods, or 4 important vitamins a day that you can get that will help you improve your oral health. It'll help your whole body health as well. Not here to talk about that, but as a dental hygienist with 30 years of experience, I want to make sure that you are the best in your mouth that you can be. So good teeth, good gums, healthy, healthy, healthy smiles. All right, my name is Becky Moore. Welcome. I'm with Restart Hygiene, and I'm here just to help you be educated about ways that you can help improve your lifestyle and your health, your teeth and gums, through vitamins and through cleaning better, and any way that we can do that. So stay tuned and learn a lot. Grab a pen, a piece of paper, and see what you learn and how it can help you. All right. So, like I said, sometimes we go straight to, if you're not flossing or brushing well, what's going on, what's happening. So we want to make sure that we're looking at the whole assets and making sure that you can improve yourself whatever way it takes to get you healthier. So let's start with vitamin number 1, which is vitamin A. Vitamin A is a fat-soluble diet. It plays an essential role in your whole body function. But for your gums, it helps with your cheeks and your gum tissues be healthier. It helps with saliva production. So not enough saliva can cause you to have dry mouth, which can cause cavities and gum disease. So we don't want that. It helps your immune function as well, so fight off infections in the mouth. Nobody wants an infection in the mouth, that's for sure. And then also gum health. We want to make sure your gum health stays strong, as well as tooth enamel. So gums, we go from gums to teeth, the teeth to gums. But we want to make sure your tooth enamel stays strong, and it remineralizes it daily and stays strong and healthy to fight off any acidic foods and sugars that we would ingest. So how do you get vitamin A in your diet, you ask? Well, if you like livers, beef livers or chicken livers, you're in luck here, because this is your vitamin. All right, so that's the easy way to get it. Also, salmon, mackerel, trout, green leafy vegetables, spinach and kale, carrots, sweet potatoes, pumpkins, those things we get in the fall of the year are helpful too, egg yolks, and fortified foods. So they fortify a lot of our foods now so we can get the vitamins that we need to be strong and healthy. Remember that vitamin A is stored in the body, so you don't want to take too much of it. So be aware of that. Make sure you're not ingesting too much of anything. Check with your doctor or your dentist to make sure you're getting just the right amount for what your needs are, and they're different for everybody. All right, number 2 vitamin is vitamin C. Love vitamin C. We all learned it's ascorbic acid. You get it from citrus foods, and it's important that we get it so we don't get scurvy. So we all learned about that coming up. So what function does vitamin C provide for you in your mouth? It helps you to have healthy, strong gums, and it helps also with your wound healing. So if you've had surgeries or you have sores in your mouth, vitamin C can really help you with that. So important to understand that vitamin C is, if you smoke, this is the point I want to make. If you smoke, the dentist that I worked for back 30 years ago would tell smokers that if you are smoking, make sure you're getting 1,000 milligrams of vitamin C a day. He would say your body just flushes it out, but your nicotine may be binding to the vitamin C before your gums get it. So if we saw a patient with a lot of gums or inflammation, and they were a smoker especially, we would tell them to get more vitamin C. So it can really make a difference in your gum health and your tissues being nice and pink and healthy instead of red and inflamed. All right, so food sources would be lemons, grapefruits, and oranges, so citrus fruits, berries, strawberries, blackberries, raspberries, kiwi. Kiwi's a good one. If we eat kiwi, we have good fiber, so that's important as well. Bell peppers, broccoli, and spinach and kale. So those green leafy vegetables, again, can help you get enough vitamin C. Remember that vitamin C is not stored in the body, so you have to have a continually amount of it. So it's not something that it's going to store up, or generally that you can get too much of. You also want to check with your doctor and your dentist to make sure that you can take vitamin C and how it can help you or hurt you. So make sure you check with them. All right, number 3 is vitamin D. Vitamin D is actually vitamin D. Number 3. That's right. Okay, so vitamin D. So vitamin D helps you with, and this is one of my favorites because it helps you absorb calcium. So it's important that you absorb calcium. If you don't have enough calcium, you don't have good, strong bones and teeth, and that is not good. So this is really important for children to get enough vitamin D. And the way you get it is one of my favorites, so we'll talk about that in just a minute. It helps with the formation of strong bones, teeth. It helps with prevention of gum disease, immune function, and tooth development. So it's really important, again, for the children to get it, the infants and children to get vitamin D, because that will help their teeth to grow strong and healthy. All right, so sources, like I said, it was my favorite one, is sunlight. You can see there's sunlight out here today. It's gorgeous outside. So sunlight is the easiest way to get it. It just takes a little bit each week to get enough through the absorption of the skin, so you don't have to overdo it on that. Also, fatty fish is good, salmon, mackerel, trout. Fortified foods, egg yolks are also good ways to get vitamin D. So should not be an issue with getting enough vitamin D for you. All right, so very good. So the last one is number 4. It's vitamin E. Vitamin E is essential because it's a fat-soluble vitamin. And so you want to, and it has antioxidant properties, which is very important. We want antioxidant. We don't want any inflammation. We want all the toxins to be flushed out, so that's even better. Gum health, it helps your gums by reducing inflammation and gingivitis. Wound healing, like vitamin C does as well, and vitamin A, as well as a dry mouth relief. We did a previous videos and some shorts on dry mouth and the importance of not having a dry mouth. So if anytime you can have a vitamin that helps you with your saliva production and saliva flow, you're going to be healthier for sure. So sources of vitamin E would be nuts and seeds, vegetable oils. So sunflower, specifically wheat germ oil, are some good oils to get in. Here comes the spinach and kale again, so good leafy vegetables. Avocados are good sources, and of course fortified cereals and foods that they do, breads, so they'll put E in those as well. All right, so make sure you get enough of each vitamin. Make sure you're not getting too much of any vitamin. Nothing isn't too good if you get too much. It's like too much sunlight or anything else. But consult with your doctor and make sure that you're getting what your needs are that you would need to be healthy. All right, so which of these 4 vitamins that we talked about, was it A, C, D, or E? Are you getting enough of each of those? What are the foods that you can incorporate that you're not? That would also be helpful to you. And what are your favorites? What is easy to get? What's harder to get? Who likes the sunlight like me? I love oranges too. Anyway, so foods that you eat can really make a difference in your gums and your teeth health. But I have to say, as a hygienist and a mother of 3, that you want to make sure you're flossing, you're brushing, you're cleaning your teeth, you're watching out for sugary, acidic foods, because they can always also hurt you as well. And that will help you be healthier here. That reduces inflammation as well. All right, so small steps. Remember this, small steps can help you be healthier. I don't expect you to go and do everything. Nobody can go and do all the things that we talked about here. What I do want you to understand is one small step that you make towards getting better and healthier. So if it's that you're going to get outside and get some sunlight, or your child can get outside and get some sunlight, and that will help them, that's a win. Small things we do can really make a big difference. So just like brushing, like if you don't brush for a full 2 minutes, brush for a full 2 minutes. See if that can help you. That's got to be an easy way to get it in. So whatever works for you, but figure that out. If you have questions, comments, drop comments below. I'll try to get up with you and see how I can help answer any questions. If you want to leave your email in there, I'll be glad to email you back and try to answer any questions that I can for you there. I appreciate you hanging out with me today. I'm Becky Moore, just starting on this channel. I would love if you like and subscribe if this brought value to you and that helped you at all. And otherwise, I will catch you on a future video because I am having a blast. And thank you again. Bye.